Hello everyone, we are doing serotonin and its receptors in this module. So let's see what's the physiology of serotonin. See, serotonin is the hormone that is responsible to keeping us awake. It is secreted during the daytime, and during night time melatonin is released, which is responsible for the sleep. Now, if we are using screen during night, then obviously this melatonin won't be secreted enough, so it will have all sleep problems and anxiety. And also serotonin is responsible for the sleep wake cycle. In pharmacology we are just learning the receptors where serotonin acts and what function does they produce and what drugs can we use to either block this or stimulate this receptor for our own benefit. This was more about physiology. Now let's study the serotonin receptor. Now the most important thing here is to know where these receptors are located. We have see 5HT, 1A, 1B, 2A, 2B, 3 and 4. This 5HT is what? Serotonin. So we have this much receptors. So we'll learn this location of this receptor with the help of a simple diagram. Okay, we are not gonna write it down in language where these receptors are there. Okay, that's just stupid way of learning. We are going to learn this with the help of diagram where these receptors are located. See, the first one, this I will explain to you in the histamine lecture, that this is a presynaptic autoreceptor. Means if you stimulate this receptor, then this drug release is decreased, so it is acting like a brake. So the first one we have here is this, and below this diagram we have brain, in which there is a blood vessel, and below brain we are having this stomach esophagus which is vomiting, and here we have stomach. So everyone is gonna learn this diagram, right? First here is a presynaptic autoreceptor, then we have brain which is having blood vessel in its upper part, then we have a vomiting stomach. So now these receptors are located at this place. See, here presynaptic autoreceptor we have 1A, 1B is here in the blood vessel, 2 is somewhere in the brain, 3 is responsible for vomiting, it is not here, it is responsible for vomiting, and 4 is in the stomach. So done. 1A presynaptic, 2 1A presynaptic, B in the blood vessel, 2 somewhere in the brain, and the 3 4 are 3 is responsible for vomiting and 4 is in the stomach. So let's see what these receptors are. 1A is a presynaptic autoreceptor, 1B is in the blood vessels in the brain, 2 is somewhere in the brain, this 3 is in the CTZ area which is responsible for vomiting. So CTZ area will be somewhere here in the brain, right? And it is responsible for what? Vomiting. And 4 is in the GIT. So we have learned the location. Now let's see what functions do serotonin do while stimulating these receptors. See, starting with this presynaptic autoreceptor which is 1A. Now whenever there is increased serotonin, it will cause anxiety. So to decrease this anxiety, I have to reduce serotonin, right? So what I do is I will give drugs that will be agonist to this receptor, so this serotonin release can be decreased. So these are what? 5-HT1A agonist which are used in the treatment of anxiety. Okay, so now we are learning the function. All the drugs we learn at the last, just remember the functions, right? So 1A agonists are given for the treatment of anxiety. Done. Now whenever there is vasodilation in the blood vessels in brain, we are get there is increased blood flow, and this is causing headache, and this is migraine headache. So what we need to do is we need to vasoconstrict this blood vessel, right? Now we know blood vessel has 1B serotonin receptor, so we are giving 1B agonist for vasoconstriction. So they are the treatment for what? Migraine. So 1B agonist will be given for the treatment of severe acute migraine. Done. So now see, this is an interesting fact. In upper GIT, if motility is decreased, then what happens? If there is no motility of the stomach, then this content are not pushed ahead, so they'll regurgitate. So the acid which is here, which is it will go to esophagus, so it will have gastroesophageal reflux disease, and acid is gonna damage this esophagus. But we have lower GIT. Here if motility is decreased, then we have constipation. So upper GIT we have GERD, lower GIT we have constipation, right? So what happens is, if there is a acid regurgitation here, we want to increase the motility of upper GIT, and the receptor present in the stomach is, we know, at the bottom was the stomach, right? So we have 5-HT4 receptors. So the agonist drugs are given to increase motility and the treatment of GERD. Now, if you want to prevent this GERD, we are giving these drugs, right? But the drug of choice are PPIs. Why? Because they reduce this acid production. So there is no acid to cause this regurgitation. So the drug of choice will be what? PPIs. Now another condition, if a person is having schizophrenia, we are giving him atypical antipsychotic drugs like clozapine and olanzapine. So our patient is happy taking these drugs. So what this drug do is they block 5-HT2C receptor. Now which is this 2C receptor? This at the center here, right? In the brain we have two receptor, right? So that's 2C receptor. So what they do is they block this receptor, but the side effect is weight gain. So he is relieved from schizophrenia, but our patient is becoming fat. So the schizophrenia guy became fat because of all this, because these drugs block this. Now if I have a drug which is not a blocker, which is an agonist, then it will do the opposite of this, right? So it will promote weight loss. So for weight loss we have 2C agonist, which is locaserin, which is given in the treatment of obesity. So this is done. Now the last one, see, in all these places we were using agonist, right? Agonist. So we were using agonist. Now there is an area called CTZ area in the brain. This area is having this 5-HT3 receptor. Whenever a drug stimulate this receptor, let's say an anti-cancer drug is there, it is stimulating this receptor which is in the CTZ area, then there is vomiting. So if I want to prevent this vomiting, I have to give this blocker, right? And the blockers are 5-HT3 blockers, which are drug of choice for chemotherapy induced nausea and vomiting. What is this? Whenever a person is having cancer, as a part of treatment we give this chemotherapy, and this is inducing what? Nausea and vomiting, because they are stimulating this area and causing vomiting. So we need to give these blockers which will block these receptors. So chemotherapy and radiotherapy or post operative induced nausea, vomiting, everywhere drug of choice are 5-HT3 blockers. Now let's summarize. These were the 5 receptors, right? 1A, 1B, 2, 3 and 4. And we have agonist everywhere, but we have antagonist for 5-HT3. Why? Because we want to stop this vomiting. So they are given in the treatment of what? Vomiting, right? The 1A agonist was given in anxiety, 2B was for migraine, 1B was for migraine, 2 was for weight loss, which was over here, right? Which is the antipsychotics one drug, and 4 is given for GERD. So we have learned the location and the function. Now just we have to learn the drugs which are acting on this receptor. Done. So from next slide we are acting drugs. So this buspreon is agonist of 1A, and for now tell me which is this receptor here. We know 1A is here, right? 1B is here, so obviously this is 2 or this is 2C. So locaserin is a 2C agonist. So you can see here that, see, buspreon is agonist of 1A and locaserin is 2 agonist. Now see, for this you have to remember. Now first of all, which is the receptor here? We know it is 1B, right? So now you have to imagine that this, in this blood vessel, someone car is going for a trip, right? And we know what these triptans or ergotamine do. They will cause the vasoconstriction, so the migraine headache can be cleared here, right? So the 1B agonist are ergotamines and triptans. Now for this CTZ area 1, we need antagonist. Why? Because we want to stop this vomiting. So you have to imagine that this vomiting is happening on a shirt. So we have sertone or sertans which are antagonist over here, and certain drugs will, there are a lot of drugs we'll study in at the end. And the stomach is at the base, right? So they are apride, they are not having any pride, they are let very down. So these are apride drugs. So here we have certain apride drugs. Done. So these are the drugs which are cisapride, mozapride and all. Here odensatron, topiratron, dolastatron and all. And we have here triptans, we have sumatriptan, naratriptan. So these were the drugs that we studied here. So, okay, so This was about the drugs. This we already studied that atypical antipsychotics like clozapine and olanzapine, which we are giving for schizophrenia and all, they're gonna block what? They're gonna block 2C, right? And their side effect is weight gain, right? Now, this chemotherapy induced nausea vomiting is of two types. Either it can be first within 24 hours. Let's say you gave this chemotherapy and within 24 hours if you are having nausea vomiting, that is chemotherapy induced nausea vomiting most of time. So we give here simply the 5-HT3 blockers. And which were the blockers? The vomiting was happening on the short light, so the sartans were the blockers, right? But if it's delayed, we give aprapetide, which is a different kind of drug, only if there is a delayed nausea vomiting. Done. Now, ondansetron has one extra use, which is used as to decrease the alcohol carving or desire to drink alcohol. Done. So that's it for today, guys. Now, this playlist is having entire pharmacology topics for your NEET PG preparations, ideally made for NEET PG. But if you are appearing for your university exams, you can also use this playlist. It covers enough content to be able to help you in your university exams, but it is obviously more dedicated for the NEET PG aspirants, right? Done. Thank you, guys. The notes are available in the PDF.